Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update here in Foxboro. So let's go right to the numbers. So as of today, August 17th, April 17th, we are at 52 cases total since March 15th. We have 23 cases recovered. Total of 28 active cases that we're currently tracking at this present time. 325 cases have tested negative. There are now 3 hospitalizations, and there was 1 person that we have not been able to connect with in terms of follow-up. So that is the total caseload right now. Total of 23 cases have recovered. 28 cases are currently active. 3 hospitalized and 1 unable to be followed up with. But the good news is that 325 people have actually tested negative at this time. On a statewide level, we're currently we currently have 32,181 cases. 140,773 cases have been tested. The greatest age group impacted is the 50 to 59 age group, which is 5,800 people that have been impacted for that. In terms of the county-wide numbers, let me just take a look at that. Hold this on the county-wide numbers. Bear with me 1 second while I update this. And the latest information on that is that we have a total of 3,342 cases that are currently been confirmed in Norfolk County. 175 deaths associated with that amount. There are no deaths associated with any of the cases in Foxboro at this present time. So right now, the state has prepared 18,000 COVID suitable beds. We currently have 3,729 patients, and there are 787 COVID ICU patients at this point in time. So as the governor pointed out yesterday, we are actually in the surge period. We're seeing the greatest impact of cases currently at this point in time. So let's take a look at what the latest report says for today. The state has begun to post the number of positive COVID cases by city and town. I did report on some of that information yesterday. So all they do is provide you an indication as to what we are with the number of cases that we currently have, but they do not report the number of deaths associated with that. So bear with me 1 second. I'll turn this off. Okay, and then the Foxboro Board of Health, and you can go to the www.foxboroma.gov website /department/health/COVID-19 health website, and we'll be able to provide you with the latest information on a town-by-town basis as to the number of cases that are actively being tracked. So the numbers we provide you are actually up-to-date information, so we can actually provide you with the latest information that we currently have from the state. On Thursday, alerts MA at 888-777 texted, looking for work, nursing homes, and assisted living residences need help now. Find out more about the jobs available, mass.gov/COVID-OTNW. That's mass.gov/COVID-OTNW. A short video of about 30 seconds shows how young people can help prevent COVID-19 with social distancing, and is available at youtube.com/watch V equals ENWINL191GTHFY. So you can get, if you look that up on, probably easier said if you just look it up on social distancing on YouTube, and go to youtube.com and look it up that way. With the increased use of personal protective gear by the public, several communities have begun to see and issue fines for used gloves and masks discarded recklessly around essential businesses such as supermarkets. This practice is not only unsightly but also dangerous because it can lead to further spread of the COVID-19 virus and other diseases. So let's be smart here, folks. If in fact you're using your gloves, dispose of them properly in the trash bucket, or take them with you, but do not throw them on the ground. That is just inappropriate. Number one, it's unsightly for the community, but it's also very dangerous. So let's be mindful of that. From the MRC email, the Cronus testing, there are, as I pointed out earlier, 32,181 confirmed positive cases in Massachusetts. There are 2,263 new cases and 1,245 deaths as of yesterday at 4 p.m. The State Public Health Laboratory and private testing facilities have now conducted over 140,000 tests for COVID-19. Over 8,000 tests were conducted in the last 24 hours alone. And in healthcare, the Commonwealth continues to ramp up one of the most robust contact tracing operations in the nation to identify anyone who has likely been in contact with the virus, even those who are not symptomatic. Today, the administration announced that the state had hired 176 employees to conduct contact tracing, along with hundreds more being trained and onboarded. Residents who receive phone calls are encouraged to have a necessary short conversation with a contact tracer to provide vital information to curb the spread of the virus. Mobile testing at long-term care facilities continues, with the Department of Public Health reporting that 279 facilities have conducted 5,883 tests, with an additional 103 facilities receiving their own testing kits to conduct their another 10,995 tests. Personal protective equipment, or PPE, continues to be distributed across the Commonwealth. Residents who are not in need of acute care but are concerned they may have symptoms are encouraged to use the Bowie Health Screening app. Massachusetts hospital bed capacity for surge capacity sits at 18,000, as I pointed out a few minutes ago, and 46% of the beds of those beds are currently available for use if needed. And on the unemployment front, 573,000 Massachusetts workers have filed for unemployment in the last 4 weeks. And the Department of Unemployment Assistance has begun to continue to feel the economic impacts of the pandemic. Those trends will likely continue for the near future, and DUA has taken significant steps to increase the staffing levels and capacity to meet this unprecedented rush of demand. I did receive a request for some help on a claim earlier today, and I will follow up on that one with the state senator's office and the state rep's office if necessary, to make sure we can try and get some help for those people that need help on the local level. Beginning last week, federally funded supplementary unemployment payments of $600 per week have begun to be distributed by the Department of Unemployment Assistance, in addition to regular benefits. Regardless of when payments are distributed, they will be applied retroactive for all weekly claims filed back to March 29th. And since switching to remote service, over 115,000 calls have been made by over 600 staff members at the DOA call center, and over 175,000 individuals have participated in the DOA's virtual town halls. Let me see, on the economic impact front, the Department of Unemployment Assistance has updated its FAQ regarding the pandemic unemployment assistance. For those who do not qualify for regular UA unemployment assistance, including self-employed and independent contractors, the portal is not yet open for applications, but additional clarification of the information required of applicants is now available. I'm told that actual portal should be available by the end of this month. I know it's a little bit of a wait, but given the fact that this is an unprecedented move, it has to be done as quickly, as correctly and quickly as possible. And let me see. Today, the U.S. Small Business Administration announced that their new loan payments approvals are on hold following the high volume of applications to the Paycheck Protection Program and the Economic Disaster Injury Loan Program. Massachusetts businesses have received over $2 billion in grants and loans from the U.S. Small Business Administration since the start of the crisis, and the legislature and administration are urging our federal partners to continue supporting this essential program with new federal legislation. My understanding is that the program has actually has actually reached the limit in terms of the amount of money it can actually put out to fund the program. So there is it's actually reached its limits. I think there were several $billion actually more requests than there was available money for the program. So that is going to be looked at by Congress, and I'm sure there'll be a new authorization that will come out to address that. Let me see. See, other things I just haven't. These are all things that I've already seen and are announced to you. No reason to keep announcing them. There's nothing new that I can see here that really is of significant interest or something that has not already been announced to you at this time. So that's the latest information that I have from the MRC, the Medical Reserve Corps. They've been providing us with the latest information on a daily basis, along with the Board of Health and John Robinson's been forwarding this information to me on a daily basis for these updates. So I'm grateful for the work that they've been doing to try and assist us in this effort. So this is just wanted to take time today to just think about the mental aspects and the kind of concerns that a lot of us have been sort of stuck in one place for so long. It's been 3 to 4 weeks in some cases. I know that their nerves are starting to get a little bit thin for some folks, and they're limited in terms of what they can do. But there is some good news on the horizon. I did hear in the news this morning that there is some potential help coming with that's being tested right now with a possible cure to the virus. So that's good news. I know that the president has also come out with some preliminary guidance in terms of how to restart the economy and get people active again. It is going to be left up to the local governors to each state to determine what is the best course of action given the amount of activity and cases that are going on in each state. I think that's actually a good decision on the part of the president to do that, so that because everybody is different and everybody is impacted differently across the country. So it's important that is reflected in how we restart the economy in that regard. So Massachusetts, it looks like we're in the surge right now. It looks like we will be impacted for this week, for this coming week, and then we hopefully will see some of the cases start to decline after this week, and maybe into the middle part of next week before we start to see that. But we clearly are in the surge right now, and obviously this is something that we have to pay close attention to and take all the appropriate precautions to make sure we stay healthy in that regard. So we're hoping that this is that we're starting to see the light at the end of this tunnel, and that hopefully we can get the economy back going. And we'll see what it means in the course of the next few weeks. I know that the governor has put May 4th as a deadline for trying to get the economy back going, at least as for the stay home advisory to be a stay home order has been set until May 4th. New York extended that to May 15th as of yesterday, so that has been extended. There's been no decision made by the governor here in Massachusetts as to how he's going to deal with it here in Massachusetts, but we'll continue to keep a close eye on that for you and report that out as needed. But we just want you to remind you that we will get through this, and we will, there is a positive side to the fact that families have been able to spend more time with each other. People have taken a little bit of a time to take a step back. Things will be different. There's no question things will be different when we come out of this. We're finding that people have been learning to work remotely and to be effective. I know that a lot of our town employees have been working remotely. I've worked remotely on several occasions and will continue to do so on a rotating basis so that we can try to make sure that we all stay safe as we continue to get through this together. So stay safe, stay strong. We're going to get through this. There's no question in my mind. I think we should stop putting smiles on our faces again and try and enjoy the good weather that's going to be out tomorrow. It's going to be a little bit on the cool side and possibly a little snow tonight, which is kind of interesting to see that. But it's probably not going to stick around for on Sunday. Sunday's supposed to be a nice day in the 60s. Maybe get out and do a little bit of walking on that day and enjoy the good weather as we have it heading into the spring. So hopefully everybody stays safe, you stay healthy, and I'll see you next time with the next update. I'll be back tomorrow morning with another update for you on this network, on the Facebook network, and hopefully you all stay well until then. Until then, take care. I'll see you next time.